I'm Daniel Fern. I'm the lead technician for dispensary services for the pharmacy department, and I just want to say a massive thank you to all the volunteers who have worked during COVID for all the work they've done. They have done a massive amount of work. The volunteers we have running medicines from the department to the wards have been tremendous over the course of the lockdown, and further they've saved around 400 hours of ward staff time, which is essential providing care to our patients during this time. It's been immensely important to keep the ward staff on the wards, and the volunteers have played a huge part of that. We've also had volunteers delivering medicines to patients' homes, supported by the freewheelers. That has been immense as well. It's meant that patients have not come into the hospital, and we've been able to make sure patients are receiving their care, and we've adapted to all the changes that COVID has brought in place. So patients have been able to stay at home, they've had their clinics at home, and we've been able to make sure the medicines get to them safely and in good time, and care has been provided throughout lockdown.
Hello, my name's David. I joined the pharmacy runner team about 2 years ago when I retired, and I joined because I wanted to do some volunteering and to support the NHS. And the job that we do is to take the drugs from the pharmacy down to the wards, and in doing that hopefully we save time for the porters and the nursing staff so that they can apply their skills to more useful things. The satisfaction that I get out of it is really just being able to help them to do what they need to do, especially during the recent COVID pandemic, when obviously all of their resources were very, very stretched, both in the pharmacy and on the wards. And our contribution to that was that I think we each walked around about 200 miles down the corridors.
Hello, I'm Chris and I'm one of the pharmacy runners. I've been doing it for about 2 years now. I took early retirement and I was climbing the walls, so I knew I wanted to do something to help. So I thought of the NHS. I love doing this because it releases the clinical teams to be able to do their job properly on the wards and the departments and things like that. I can get quite a lot of steps in, so it's good for me as well. And it's just been so different through COVID. It's been a lot quieter in the hospital as a whole. But for us, it's been quite busy because a lot of our colleagues haven't been able to come in. They've been shielding, or they're just not able to come in at all. So we've stepped up and we've taken over quite a few more shifts than we used to do. But it's enjoyable because I think fundamentally we all just want to be needed, to be useful. And I feel as though we are. So that's what we do.
Hi, I'm Mike. I've been a pharmacy drug deliverer now since 2019. I started doing volunteering because I had such great service when I came into one of the clinics at the hospital, and I was well treated by a volunteer there, so I thought that was something I can do, and I was directed to the pharmacy running team, which is great. I do a lot of walking. It's quite tiring, but I think we really help the wards because the nurses and the nursing staff don't have to come to the pharmacy to get their prescriptions, and I think it helps them as well. I've met a whole load of fantastic people. The nursing staff, despite being really under pressure, are really great and friendly, really welcoming. Maybe one or two odd exceptions when they're a bit frazzled, but there you go. During COVID, we've taken up more shifts because of the shortage of staff. But one thing I will reflect on is that some of my friends said to me, "It's COVID, why are you still going down to the hospital?" And I said to them, well, it's really good down there. The infection prevention team is looking after everybody there, and there's probably more chance of me catching the virus in a supermarket than there is down the hospital. So I'm really happy to have carried on.
I'm Nigel Warwick, and I'm a rider with 7 Freewheelers, the blood bike organisation which has been supporting the Wye Valley Trust since 2007, although things have only really picked up in the last 3 years since we've had a marked bike in Hereford. With COVID, working with the Trust and in particular the pharmacy, 7 freewheelers have expanded our normal out-of-hours operation to become 24/7, and also recruited volunteer drivers known as the Farmy Army to deliver medication during the day using their own vehicles. We were also assisted by Blood Bikes Wales, who took medication from the border in order to reduce the time our bike was away from Herefordshire. The joint efforts of the pharmacy and 7 freewheelers created a highly effective system that enabled over 1,100 jobs to be delivered between the 1st of April and the 31st of July. This helped reduce the footfall in the hospital significantly and has also reduced the risk to both patients and staff. It is clear from the reaction during deliveries that people were most appreciative of the service we were able to provide.
Hello, my name's Thomas Elwood. I'm the lead pharmacy technician for technical services, and from my perspective for the pharmacy delivery service throughout the COVID-19 pandemic, we've been delivering out urgent chemotherapy to our shielding patients, some as far afield as Wales. So it's really helped those patients who haven't been able to get into hospital because they've been having telephone consultations with their consultants, that they've been able to get that medication as soon as, so that they can continue their treatment, so that it's the maximum benefit to them. I think without the pharmacy volunteers throughout this time, I think we'd have really struggled to meet those patients' needs throughout this, and without them, you know, the service would have fallen apart. Really, they've been an absolute credit, and the service they've provided has been brilliant. Just like to thank them for that.